Today, we welcome in Dr. Eric Eskioglu. He's the Executive Vice President and Chief Medical Officer over at Novant Health. Doctor, it's great to have you on our program, and welcome to Wilmington in southeastern North Carolina.
Thank you so much. I'm glad to be on the show. I really appreciate it.
You bring a different type of conversation to what we've been discussing over the first couple of interviews. Why don't you talk about, because I think in broad terms, many people don't really kind of understand the intricacies and all of the ins and outs of what goes on behind the scenes. People go to the doctor, they get treated, they go home. They get a bill sometimes, and then they move on. So I think understanding kind of the inner workings in the way in which the system operates is of great value to those who are tuned in. And with that said, so talk about your role as Chief Medical Officer at Novant Health and some of the responsibilities day-to-day that you have.
Yeah, absolutely. I'm responsible for the safety and quality of our care that we deliver to our patients. And, I work with a lot of great people in our organization. And I also am responsible, I'm a co-executive of our Novant Health Institute of Innovation and Artificial Intelligence. And, we've generated a lot of data over the last 10 years. When we went to electronic medical records, we've been able to collect a lot of great data on our patients across the state. But unfortunately, some of that data is locked up. What I mean by that is we don't utilize it to the maximal abilities that we should. And that's where we started working with artificial intelligence and machine learning, trying to predict patterns from that data. And my personal goal is predicting patients before they get sick to prevent them from getting sick rather than waiting till they get sick. That's a little bit too late. Obviously, that's still going to happen. But the prediction of when someone may get sick and when we can intervene before anything bad happens is going to be moving to the future.
Well, there's no question, education and understanding on how you need to be mentally and physically fit and the things that go around that. It is, an ongoing process and a practice that, even those who are all bent on, physical and mental health are still working day to day. And I think, there's a big gap there between those, of course, who are working each day to make sure that they're eating the right foods and getting the proper exercise and the mental stimulation that keeps you healthy to bolster your immune system. And then there's the other side of the spectrum where people just don't have those opportunities or have the economic positions to be able to take advantage of many opportunities that are out there to make sure we're mentally and physically fit. So what you're trying to do is a preventative measure to provide that type of information and utilizing AI, artificial intelligence, to do so. And we've come such a long way. Obviously, we're not at the flying car stage yet in our country or around the world, but I won't be surprised if we don't get there soon. So talk about how artificial intelligence can have an impact on clinical everyday care.
Yeah, this is very similar to, I'm sure a lot of your listeners have heard about self-driving cars. That's all artificial intelligence. So it's moving leaps and bounds over the last 2 to 3 years. And healthcare is actually going to be one of the biggest beneficiaries of this new science. What we are intending to do, and we've already partnered up with some of the bigger artificial intelligence companies and co-creating some of these, is preventing people from getting sick. We want to predict when they get sick, we're going to predict what's the best methodology to treat them. By doing this, we'll be able to personalize medicine. So everybody's fingerprint is different. Everybody's eye color is different. We're going to be able to personalize medicine based on your data and not generalize. We give one medicine that will treat a lot of patients for, say, blood pressure. And, this is really exciting to me and to our teammates here. We look at artificial intelligence more like assistive intelligence because it's going to make our doctors, our nurses, our physicians so much more effective and efficient that they can really focus on the patient. It's going to be kind of your guide to give you some suggestions, help you make the diagnosis. But at the end of the day, the doctors are going to be the ones that are going to come up with the decisions with the patients, but be able to spend a lot more time with the patients because they're going to be freed up from a lot of the clerical work, from a lot of the mundane work that they do currently.
Dr. Eric Eskioglu is with us. He's the Executive Vice President and Chief Medical Officer at Novant Health. It's part of our set of discussions that we've been having with the potential and soon-to-be partner and owner of our new Hanover Regional Medical Center. This is a big deal here in southeastern North Carolina. So again, I want to reiterate the importance and give a tip of the cap to people at Novant Health, one side of the issue or the other, as to where you think the hospital should go. The ability to speak to members of your executive team and to get information as to what they're doing, not only inside the hospital and through the healthcare system, but community outreach efforts, as we discussed throughout some of our early conversations, and then today, how they're taking innovation and technology to the next level in this 21st century that we're living in. Dr. Eskioglu, talk about how Novant Health is using that artificial intelligence to be on the cutting edge of what we're doing as to how we treat and look at patients across the board.
Absolutely. And being a neurosurgeon, and my father unfortunately passed away from stroke 2 years ago, I'm very passionate about stroke treatment. And our state is the buckle of the state, the stroke belt, unfortunately. And so we actually started teleneurology to treat our stroke patients many years ago, about 8-10 years ago. But over the last year and a half, we've added artificial intelligence, which is called Viz AI, layered on top of our teleneurology network. And as a matter of fact, we've partnered up with New Hanover, and New Hanover is already the beneficiary of Viz AI. What this does is you lose about 32,000 brain cells every second of a stroke. So you're talking close to 20 million brain cells in 10 minutes. That's a lot of brain cells to lose. So time is of essence. And what we've done is when the patient goes to get a CAT scan in the ER, the artificial intelligence through your smartphone alerts the physician that the patient has a stroke, looking at the machine learning and looking at the images on the CAT scanner before the doctor can even visualize it and call. And this also streamlined our process. We're able to activate the whole team through our smartphones that are HIPAA compliant and be able to get the teams on the stroke victim quickly. We've actually we were already one of the nation's best in time for treating strokes. Normally, the time to treat strokes on average is about 60 minutes. We're running about 39 minutes, which is way below the national average. With this artificial intelligence tool layered on top of our teleneurology service, we've been able to lower this down to 29 minutes, which is incredible. We're not stopping there. Our goal is to get it down to less than 15 minutes, so every patient has a good chance of surviving a stroke and leading a very meaningful life. The one other thing we're proud about is we have actually been able to personalize the medicine, but also able to provide health equity. What I mean by that is, regardless of the entry of the patient into our system, it could be in a rural area, it could be an urban area like uptown Charlotte, they get the same exact stroke treatment anywhere in our system. And that's what we're proud about. We're able to provide health equity across the system for stroke for all our patients. And we're going to strive to do that for every field we touch in medicine.
Dr. Eskioglu, this is a huge innovation that obviously comes with a cost. So what has Novant done to kind of invest in AI so you can utilize it across the gamut, as you mentioned, in neurology and facing many other conditions?
Yes. So we actually, the biggest cost, believe it or not, is the human capital. We have tremendous team members that are on our team on the digital and product services. We have actually teams that do cognitive artificial intelligence. We have PhD data scientists at Novant Health. We have at least in the clinical realm, we have close to 35 data scientists that do nothing but help us figure out how we can improve the safety and quality and personalized medicine to our patients every day. We've also been lucky to partner up with Duke Foundation. The Viz AI stroke protocol, they've actually granted us a sizable amount of grants to spread it across the entire state. So we partner with Duke Foundation for a lot of our artificial intelligence initiatives. We have also another one that's really near and dear to my heart because, unfortunately, being a doctor, I have family members that have passed away or had breast cancer. We've teamed up with MIT and Harvard, where the three centers that are working on predicting breast cancer, looking at the mammogram with artificial intelligence up to 4 years before a naked eye can predict. Just think about that. Just think about the human cost if somebody gets diagnosed with breast cancer and it's a little bit on the later stages. All the chemotherapy, all the pain, and the anxiety somebody has to go through. But if you can predict that somebody's going to have a breast cancer at least 3 to 4 years before a naked human eye can see on the mammogram, you can imagine the possibilities. So we're really excited about that too, and be able to offer it to our communities where we serve.
Now, these are just some aspects of how you are currently utilizing artificial intelligence and in the medical practice, and of course, all of these strategic partnerships and collaborations allowing you to do so, along with getting grant money to continue to invest in the future. So, talk about the future. What other ways do you want to use artificial intelligence in the future when it comes to medical and healthcare?
Great question. So we actually it's going to be announced over the next couple of weeks. We became the first inaugural recipient of Microsoft's Iconic Healthcare Award, which is in the AI arena. And we're closely working with them for both opioid addiction, how we can prevent it, and how we can utilize artificial intelligence to be able to not only identify but support patients. And also we're working on a virtual hospital that we can put up together with artificial intelligence, meaning, about 60 to 70% of patients eventually will be able to check into a virtual hospital, get all their treatments in a virtual hospital environment without ever having to step into a real hospital. And we're really proud to work with Microsoft on that. One of the things that personally has concerned me over the last couple of months is because of the pandemic and because of the economic depression, we know from 2007 to 2008 time period that the opioid use had gone up about 35% in this country. Suicide rates have gone up. So we're going to have a challenge over the next couple of years how to deal with that. So we're trying to stand this up as quickly as possible to serve our communities and help our patients in need.
Well, from our quick conversation, you can quickly figure out that there's no question Novant Health is on the forefront of this innovative technology. And when you speak about opioids, this is ground zero here in the Wilmington and southeastern North Carolina region, along with many other places around the country. And I think this could be one of the groundbreaking things locally that could help change the tides on these types of things when it comes to addiction and many other chronic diseases people face day to day. Dr. Eric Eskioglu is the Executive Vice President and Chief Medical Officer at Novant Health. Doctor, it's been a pleasure to catch up with you today. I think you're providing some valuable information as to what people here in New Hanover County and the surrounding area can expect if and when Novant Health takes over control of our hospital here at New Hanover Regional Medical Center. Thanks for the time today.
Yeah, thank you so much. And we're really looking forward to working with the wonderful people at New Hanover Regional Medical Center. Really looking forward to pushing the boundaries. Thank you so much.
Yeah, and Doctor, with that said, given the advancements in technology and innovation and how quickly they come about, please keep us abreast as to some new movement on this subject.
Absolutely. I hope to join you in about 6 months to a year, and we can talk about what we're doing in New Hanover and the nexus of things hopefully will come out of New Hanover as well. Really excited. Looking forward to that conversation. That's Dr. Eric Eskioglu. He's the Executive Vice President and Chief Medical Officer at Novant Health.